All right, go ahead, Dr. Lor.
Great. Thank you so much for the introduction. So today I will be discussing my journey into academia pharmacy and then experiences in ambulatory care. And so the four pillars of academia are the education mission and teaching, to scholarship and research, and then our clinical practice site, as well as leadership and service. So thank you all for joining. I'll be kind of speaking about academia pharmacy. So in the education mission, I teach in the self-care and wellness course, and this course is in the first year pharmacy student class. We explore topics on over-the-counter medications and also talk about wellness, complementary integrative medicine, and herbal medicines. And so I'm excited to be a part of this course because this is actually in the 3 months in from the MCW Accelerated PharmD curriculum. You're actually going out into clinical practice sites on Fridays. And so basically you learn a different disease state every week. So it might be pain and fever disorder or cough, cold, and allergies. And then on your Fridays, you could spend that time to actually look at some of the over-the-counter medications as well. I've also led an effort called the Happy Initiative, which is the health advancement for Asian Pacific Islanders through education. And this was created by our team that's in the small photo on the bottom of medical students. And we basically created a health equity online curriculum to build skills with Asian American, Native Hawaiian, Pacific Islander communities. It has various case studies from the introduction module around the history of Asian American, Native Hawaiian, Pacific Islanders, and then focusing on various disease states, as well as a local spotlight looking at the Hmong community and a case study around cancer and the cancer diagnosis. And then we have various other disease states that we kind of focus on, from mental health to cardiovascular health to cancer. And it kind of describes it in a case study basis. We also host live workshops. And so in the past, we've actually had a shaman come to campus and had some food. We got a small learning grant to have those experiences. And then last year, we had the Taste of Happy, which was basically learning how to make egg rolls and enjoying the food, as well as learning how food impacts culture, as well as the history for patients. I also teach the medical Spanish elective course, Puedo hablar español también. And so this is actually a course that's once every week on Tuesday afternoons for an hour and a half. We also basically go through a different medication. So this next week, we're actually learning about each of the students. They created a patient counseling presentation. So we'll be learning about thyroid medicines to how to check a blood pressure in Spanish, to how to counsel a patient on inhalers in Spanish as well. And then I just wanted to share for education, research is an area that I've taught in the past as well, being the former director of the research certificate program. So teaching student pharmacists, I just gave a talk on biostatistics refresher for pharmacists, and then mentoring resident pharmacists and fellows to learn about the basics of research, from the drug, like performing a drug literature evaluation, to how to analyze your own statistics, and then also how to present a poster and writing up a manuscript with scientific writing. So these are just some different aspects of the education mission that I'm a part of. Now, onto scholarship. So community engagement is a type of research where you integrate community voices into the work of the research process. So there are various different projects that I've been involved with. The first one that basically opened my eyes to community engagement was being accepted for the Clinical Scholars, which is the Robert Wood Johnson Foundation. And we did a project working with Dry Hooch, which is a peer mentor program for veteran communities. And we created a curriculum which basically helped assist veteran peers to help others that were struggling with addiction. With this project, we basically created more capacity for Dry Hooch to launch their curriculum to veteran communities across the nation. So they have a peer training curriculum, and then the opioid addiction curriculum was a piece of the larger picture. So these are my collaborators here. But this was basically what kickstarted my work in community engagement. This project was more geared towards veteran communities. But basically now I have work with Hmong refugee communities. And so here are just some pictures of things that I've been involved with, mainly a trainer at the Hmong Institute. I usually do that every other year, basically training pharmacists as well as other, it doesn't have to be healthcare either. It could be any professional that wants to learn more about cultural competency as well as working with the Hmong communities. So every year there's a Hmong Health Summit. And as a trainer, we basically provide insight into the disease state that we're going to be offering for that year. So we've done cancer, which is this year, to domestic violence, to just chronic disease state management. And then basically the focus of each summit has been to learn more about the intersections of Hmong traditional animism, as well as how it interacts with patients' care. And then also in terms of domestic violence, we actually had a social worker present, a lot of groups around discussing like different the murder suicides that are happening within the Hmong community and trauma and how it impacts patients and as well as the community at large. And so there's many different aspects, but that's just in one example of some of the work I've done with the Hmong Institute. And then the Milwaukee Consortium for Hmong Health is a organization based here in Milwaukee that I've worked with for several years. This year, they're hosting their annual health conference in April. And basically, this is a health screening event, as well as various vendors coming in, providing care for patients that are mainly Hmong, Karen, Karenni, and then also Spanish speakers that are coming to this conference. And so each year, basically, these are types of projects that you're kind of involved with, but the community engaged research aspect is working with the community to highlight something that the organization wants to improve. So for example, for the Hmong Institute, I worked on a COVID-19 vaccine survey that was provided during the COVID-19 pandemic. For the Milwaukee Consortium for Hmong Health, we have a couple of community engaged projects around education and liver cancer to cervical cancer to explaining what does cancer mean when in the Hmong language there's no word for cancer. And so now there's some projects that I'm working on around diagnostic excellence and how do we improve the conversation about cancer is if you aren't able to also think about how the language impacts their thought process around the diagnosis as well. And then I included a couple of these other partners that I've worked with over the years, including those that were in the media, developing different educational tools, to even doing a project around the intersections of diabetes, type 2 diabetes, and the social determinants of health. And so I've pivoted from veteran communities to working now mainly with Hmong refugee communities, but also with any other new refugees that have come over to the United States and are here in Wisconsin as well. And then this is just a photo of our culmination of the Robert Wood Johnson Foundation Clinical Scholars Program. It's a leadership training program that builds health equity leaders across the nation. This is us doing some work actually in Puerto Rico. And then this bottom picture is the one we were actually a panelist in the celebration. So all in hopes of basically building health equity for the communities that we serve. And then as an educator, there's different places where you can actually do research, right? It could be within your practice site. It could be community engaged research that I've been doing with, and then also teaching and thinking about ways to teach or developing novel tools to teach, or even impacting, the way that things are taught within the classroom or in the lab. And so I've done some studies around empathy. We have a project coming up on student success. I've given some talks around inclusive precepting, as well as the happy curriculum and presenting it at like national educational conferences as well. All right. And then clinical practice. So I've worked in ambulatory care for now, I looked at 16 plus years, which is crazy how time flies. My first clinic was actually in residency. It was with Westside Community Health Services. And then I basically became a pharmacist, my first academic appointment at Torrey University, California, College of Pharmacy. My practice site was at Ole Health, which is a federally qualified healthcare center that serves Spanish-speaking communities, the migrant workers that work in the vineyards in Napa, California. So imagine warm weather and wine country. I took walks every lunch hour. And I think about that experience. I basically started in a small room, a dispensary. I was one of the only pharmacist there. We had a pharmacy technician and also a pharmacy manager, and I basically grew the practice from the ground up. So what is ambulatory care? Basically, it's in the outpatient clinic setting. So it could be at a doctor's office or a clinic setting. And then basically what we did is we provided, they call it holistic care. So holistic care means that you can review all of the different medications and the disease states. The main disease states that I basically managed were diabetes, high blood pressure, high cholesterol, anticoagulation, and vaccinations. And we had implemented 7 collaborative practice agreements. So collaborative practice agreements basically allow you to prescribe medications. You can send labs. You could order, medications to the pharmacy in these various disease states. And I think what's interesting is that I started with this high blood pressure. And then that small dispensary basically grew to more and more collaborative practice agreements. So they trusted me with high blood pressure, then added on diabetes, then added on, inhaler education to smoking cessation. And then crazy chronic pain management was the thing that I did not want to manage. Um, I was like, I don't know about the DEA numbers and those pieces, but I ended up being a part of their pain management oversight committee as the pharmacist in charge. And then my students would actually do a grand rounds and review patients that had high morphine equivalent dosing to see what we could do to help decrease, create a plan to decrease the patient's pain medications. And so what I would say is that you never know where you're going to end up, which disease states that you might be most interested in, but providing that holistic perspective and performing these comprehensive medication reviews has been key in growing the practice. And so that small dispensary that I was in basically grew to having my own patient care room, and then actually grew to 2 patient care rooms and actually having my own office space. And then the dispensary was separate. And so we supported there was five providers in each pod. So there's about 15 providers for every day. And in the beginning, I only saw a couple patients every day. But over time, I grew the practice and we saw about 8 face-to-face patient visits a day, ranging from comprehensive medication reviews to disease state management. And I think my busiest day, I actually saw 20 patients in a day. So very busy day that we stayed very late. And so that's the experience that I've provided in the ambulatory care setting. And so these are just some photos of different disease states that you potentially could manage in the ambulatory care setting. Just know that in ambulatory care, this is more of like a holistic ambulatory care setting, but there's other ambulatory care pharmacists that specialize in specific areas, whether it be cardiology, only doing hypertension, high blood pressure, only, reviewing patients with diabetes. And in this case, since I was the only pharmacist in that entire healthcare system, we provided any disease state, would come up every day. And so it was a very exciting kind of initiative to be a part of from the ground up. And then basically I grew that practice site. So that was about 6 years that I was out there, was their interim director of pharmacy for some time, and then came back to Wisconsin, my home state. And now I practice actually at 16th Street Clinic on the south side of Milwaukee. Mainly the disease states we manage are diabetes, high blood pressure, high cholesterol. So more of the chronic care management. And so how do you become an ambulatory care pharmacist? First, you have to graduate with your PharmD degree. Now what's required is a PGY1 residency. In addition, you have to do a PGY2 residency in ambulatory care. And then ultimately, culmination, you think that your NAPLEX and your MPJE are the most difficult exams, but actually board certification is probably one of the most hardest exams. And then you also have to make sure you keep in track, of your continuing education hours. So once you obtain board certification, it's about 100 contact hours that you need over 7 years. And I'm actually nearing the end of my 14th year. All right. So what do I do, right? What does a visit entail? So one of the things that's helpful is that if you're able to speak other languages, so puedo hablar español, kupo Hmong tiel. So it helps with building rapport with patients. And I've noticed that connection is just really important to really help patients just overcome any barriers that they might have for medication access. So at 16th Street, we have a team of about 10 providers, and I usually have about 5 to 6 providers that I'm working with every day that I'm in clinic. Mainly, I'm providing comprehensive medication reviews, really to improve patient adherence and working with patients with complex medications. And so I was going to just describe a little bit about the patient care aspect. So we use the pharmacist patient care process when we're providing patient care. So as I told you before, my previous clinic, we had about 8 patient visits on average every day. Here at 16th Street, I'm usually only a half day. So I would see about four patients on average every time I'm in clinic. And so for each patient, this is the process, right? We collect information, we're asking questions, we're making assessments about the different conditions, reviewing the labs to ensure patients' medications are indicated, meaning there's some type of indication. Is it high blood pressure? Is it diabetes? What is the medication for? To efficacy, which is looking at if the patient's, let's say it's blood pressure, their blood pressure is at goal or is it not at goal? Identifying, they say, drug therapy problems. So whether you're going to increase a dose, decrease a dose, or if there's a side effect to a medication. And then putting together a plan for the patient. So you might start medications, stop medications, continue medications, and then implement the plan that's created, as well as follow up and monitoring, right? So that could include sending what's it called, a communication to the provider about potential drug therapy problems, or even, let's say it's to the chronic care team and providing education for patients. And so this is just a health literate medication list that I use when I'm performing my comprehensive medication reviews. I actually just finished one last Friday. It was a patient that came from the hospital. And so anytime they call it transitions of care, going from the hospital back to the clinic setting, there's a lot of discrepancies of different medications that have been started, which ones the patients have to stop. And so what we do is as the meeting with the clinical pharmacist, we go over all the medications, and this is in Spanish. It says, mi lista de medicamentos, traiga todos sus medicamentos. So bring all your medications and this list to each visit. And then it has the name of the medication, su nombre de medicamentos, the dose, when to take, right? Morning, noon, or at night, and then what the medication is for. Is it for high blood pressure, diabetes, cholesterol, or what other conditions that the patient has? So it could be migraine, right? Or it could be pain, or it could be seizure, or mental health as well. So just thinking about what you could potentially incorporate. And I'm just going to go back to this slide. These little colors listed here. So we just finished a patient comprehensive medication review last Friday, but we labeled the medication bottles, yellows in the morning, blues in the evening. Think of the sun, right, rising, and then the setting, so blue in the evening, and then I usually do red as needed. I try not to like do 4 times a day just because it's a lot of medications to take. And then green is kind of in the middle of the day. So we labeled the patient's medications. We write what the medication is for on the bottle. We talk about the refill process because sometimes patients don't remember, if they need to go refill their medications. And then we also go through labs, like important labs. If they have diabetes, we talk about A1C. If it's blood pressure, we talk about systolic blood pressure. What is diastolic blood pressure? Where do the medications work? If they're on 3 blood pressure medications, is it in the heart? Is it in the veins? Is it in the kidneys? So we just talk about different ways so patients can make sure they understand their medications and which medicines are most important. So after the visit happens, so actually our visit was very long, this last one. It was about an hour. Usually we shouldn't spend that long, but there was a lot of medications, actually. There was about 20 medicines that we had to go through and double check if the patient had them or didn't have them. And then afterwards, we document the visit, and they call them SOAP notes that basically provide an overview of what happened during the visit and then helps to communicate with the provider of what medication list the patient should really be taking. And so these are types of visits that ambulatory care pharmacists can provide to really help the healthcare team as a whole improve health outcomes for patients. All right. And then the last kind of hat that I wear is around leadership, as well as service. Service meaning it could be service to the school of pharmacy, it could be service to the university, or service to like the community. So you could be a part of like different organizations and be a part of different aspects. Like I'm part of ACCP, Ambulatory Care PRN Network, to the AACP, the larger pharmacy education conference. And so some of the roles that I play is founding chair of the clinical sciences department, overseeing a lot of the clinical practice advancement initiatives. So pharmacists going into different sites and verifying their credentialing and all the behind the scenes that go about for students to be able to practice at those sites as well. And then some of our faculty in the clinical sciences department don't have practice sites. They might be more in the social administrative pharmacy practice area. So all of those faculty report to me at MCW. I've also been a part of, sometimes at the academic kind of lead of these different programs that have been developed from the ground up. And these teaching certificate programs, as well as research certificate programs, are offered through MCW, mainly to our residents and fellows, but also we've included pharmacists, preceptors of ours, and then even doctoral, like if they're part of the fellowships for MCW, they've been a part of those as well. I also serve as the director of our academic pharmacy fellowship, and then also a residency site coordinator for the Walgreens MCW PGY1 residency program. And this is an emphasis in specialty pharmacy. So specialty is a definitely brand new area of pharmacy. It's not quite ambulatory care because you're not really in a clinic setting, but it also is not in the retail setting that you typically think of where you pick up your medications. And so specialty is an area where it's basically high cost medications that have a lot of rules. And so you could become a specialty pharmacist. And what I've seen working as a residency site coordinator is there's so much opportunity for the pharmacist to learn about those specialty disease states like neurology, HIV, fertility, to mental health, and so oncology. There's so many different medications that just require a lot of rules. And so that specialty pharmacist makes a huge impact on patients to really get access to high cost medications. And so that's just a piece, of the pie. But I'm not a specialty pharmacist myself, but I have learned a lot about specialty pharmacy. And so if you're interested in just not becoming a ambulatory care pharmacist, but also not wanting to be a community pharmacist doing the lick, stick, and pour, specialty might be an area where you could grow in as well. And it's a growing area of pharmacy. Okay. And then I think as a new mother, I have four babies at home. I've also been supporting and advocating for inclusion of women. I received the 2022 Women of the Year Award from Women's Pharmacist Day. And I always think about supporting and ensuring women are also feel included and belong in the workplace. And so that's just a part of the things that I do. All right. I'll open it up for any questions.
No questions.
No questions? Okay.
I just find it very interesting how there's so much more than just it's a lot. It's just a lot. That's why I don't have any questions. That's all.
Yeah. I think a lot of people only know about community pharmacy or maybe hospital pharmacy, but there's definitely other areas of pharmacy that you might not know.
Yeah.
Yeah. And I think in pharmacy school, I would say I never imagined I would be doing what I do now.
Yeah. Mhm.
I thought I was going to be just an ambulatory care pharmacist. I did not think I was going into academia, or I knew I wanted to do ambulatory care, but I didn't know I was going to do all the other stuff. So,
Yeah.